Good morning, dear colleagues. I present National Center of Disease Control and Prevention of Republic of Armenia, and let me introduce you a report devoted to assessment of antibiotic use in acute respiratory infections among school children in Armenia. As we all know, all children several times a year have acute respiratory infections, and they are mainly of viral etiology. Symptomatic therapy is mainly used in the treatment, but not always. Many children with respiratory infections receive the antibiotics, either because parents believe in their effectiveness in viral infections, or because pediatricians suspected bacterial infection, or simply out of insurance. In addition, parents don't always refer to the doctor, but follow the advices of their friends or pharmacists. And still, in Armenia, the antibiotics are released without a doctor's prescription. So, the aim of this study was to evaluate practice and to evaluate the level of awareness and practice of antibiotic use in the treatment of acute respiratory infections of children of different ages. A cross-sectional study was conducted in capital of Armenia, Yerevan, in February-March of this year. 9 schools were chosen randomly. In survey, we included the parents of all children who had acute respiratory infection during last month, so that the parents that remember the name of all used drugs. We estimated a sample size of 185 parents. Data was collected with standardized questionnaires. Descriptive analysis and graphs have been done using Microsoft Excel. Which result did we receive? Out of 185 respondents, 37% didn't refer to the doctor. With increasing age of children, the frequency of application decreased from 66 to 52%. It was established that 53 respondents had used antibiotics. Among younger children, the antibiotics were used more frequently than in elder ones. If penicillins, macrolides, and cephalosporins were mainly used in the group of younger children, but sulfonylamides in the group of elder ones. Every third of antibiotic users didn't recognize that they used the antibiotics, especially parents of elder children who frequently didn't know that sulfonylamides are antibiotics. Only in 68% of cases, antibiotics were prescribed by doctors. The higher was age of children, the more was frequency of self-medication frequency, and it reached 71% in the group of 15-17 years old. In addition, almost 30% of children receive antibiotics less than 5 days. We also asked general questions about antibiotics, and we received following answers. 45% of respondents didn't know that antibiotics have no influence neither on viral nor fungal infections. 36% of respondents hadn't satisfactory knowledge about mechanisms of antibiotic resistance development. 1/3 of respondents confessed that they were not compliant with the prescribed treatment deadlines. Nevertheless, the majority was against to receive antibiotics more than a week. And finally, the quarter of parents were against to get antibiotics only by medical prescription. Thus, this first antibiotic use survey in Armenia. In both developed and developing countries, self-medication with antibiotics is common for illness presumed to be caused by a virus. However, the present study showed that the prevalence of non-prescription use of antibiotics for children in Armenia was 29%, and it is higher than in early reports from Vietnam and Mongolia, but less than in the China, Ukraine, and neighbor Georgia. As well as in other countries, most people in Armenia don't know about the antibacterial effect of sulfonylamides, which leads to its uncontrolled widespread use. Our study had some limitation. The first one, in Yerevan there are approximately 10 private schools, but they were not involved in the survey. And another limitation is that findings from this urban sample cannot be generalized to the whole population of Armenia. In conclusion, the survey showed a high prevalence of uncontrolled antibiotic use. Many people still erroneously believe that antibiotics are effective against viruses and are not aware of antibiotic resistance development. As well as in a high percentage of parents are again to get antibiotics only by medical prescription. So, we recommend proper education among population about outcomes of antibiotic resistance, especially among parents of school and preschool children, and insistently recommend to refer to the doctor, as well as practical implication of already existing law about getting of antibiotics only by a doctor's prescription. And in the end, I would like to express my gratitude to Armenian National Center of Disease Control of Armenia, Department of Health and Department of Education of City Hall of Yerevan. Thank you for your attention.
Please, any questions from? Okay, if no question, I have one question. These parents, are you analyzed parents, for example, by age or for parents' education or
no.
Parents, for example, if medical doctors was among parents?
We ask if the parents are doctors because when we analyze the situation, has been the treatment prescribed by doctors. If the parents was a doctor, we count it as a doctor prescription. But we analyze by age of children.
I have a question, very interesting presentation, and congratulations for having this opportunity, and as the first survey is very important. You referred to a law, legislation regarding prescription of antibiotics. It exists already, a legislation that says that antibiotics should be only administered if they have been prescribed. That's my understanding from one of your last slides. So my question is, how are you going, and what are the measures to make sure that this law is more enforced? Is there any contact with the pharmacists to see if there is an influence also on the normal practices of selling or delivering prescription or giving advice? Because I think that
I agree with you. I understand you. Thank you for the question. The law about getting antibiotics only by prescription existed during last 2 or 3 years. I know that implication of this law will be in next year in Armenia. It will do it more strong, and I think we have the practice in neighbor Georgia, who people have the same mentality as in Armenia, and if it can rule in the Georgia, it can rule in other countries also, and I hope that it will have his results.
Good morning, my name is Stella Gheorghiță, Republic of Moldova. Congratulations for very nice presentations, and thank you for your attention to this very important problem like antimicrobial resistance, what everybody knows that this is a global threat. And I would like, it's not a question, it's a comment, but because what you present here is absolutely represent situation in the Republic of Moldova. And, I would like to share with you that some success in this area happened this year. Also, as in Armenia, Republic of Moldova has a law, but law was not enforced, and of course the pharmaceutical company, let's say, not respect the law in the proper way. But Ministry of Health approved the decision and involved them in this process, and they discuss broadly this issue, including with pharmaceutical company. And another area of work was healthcare doctors, and for them was clear they have to prescribe in according with protocol, clinical protocols, and the insurance company can count them if they respect this protocol. So this problem have been solved because this is a common problem in maybe post-Soviet Union countries. It's rather common, and this is a kind of suggestion. This problem can be solved, or a solution can be found when you involve in the process all partners and all actors. Ministry of Health as decision makers, doctors who have to prescribe in appropriate way antibiotics, and pharmaceutical company who have to understand that this is not commercial things. This is not a business. This is something what have to be protected today. So congratulations.
Thank you.
Thanks for your comment. Please.
Thank you. I would like to congratulate Gennady. We discussed this presentation during the review model in Greece. Of course, just to continue Stella's opinion, I'd like to mention two parts. One, of course, to enforce the law for prescription, but other part is to educate population, because as you mentioned, post-Soviet countries used to
Yes, of course.
overuse antibiotics, and we discussed this topic. In fact, there are some points that population usually use the same antibiotics if it helped last time, for example, for the same symptoms. And another situation is if they give this antibiotics to the relatives. That's really happened, and congratulate for your presentation. Thank you.
Thank you.
Thank you. One more question. Just one comment, don't take example from my country, because after this 3 years ago, when we are starting to use antibiotics and sell antibiotics in the pharmacies just after the prescription, then our pharmaceutical industry find a way to avoid this, because now in huge pharmaceutical companies, they have medical doctors inside in the, not inside in the apothec, but somewhere nearby, just on the, and they prescribe you any medicines, not just antibiotics. And some pharmaceutical companies even have some fun conversation with doctors. It are their doctors. You can just call to doctors, and doctor prescribe you this antibiotics what you order to him.
Yes, that's a problem.
Pharmaceutical companies always find a way to avoid any restrictions.
Please.
May I ask, thank you first for the nice presentation. I wonder if you ask about the level of education of parents and
No.
socio-demographic level. Maybe when you formulate a message targeted to a special population, you may need to know which people you will target this with.
No, it wasn't the aim of our study. We asked only the age of children, and it was the parents of children from public schools only. As I mentioned, private schools unfortunately weren't involved in the survey.
Before we pass to the next, I would like also to comment that I think that you are aware that very recently there was a European Antibiotic Awareness Day and a Global Antibiotic Awareness Week organized by WHO as well. So my question is also if you are considering to have some kind of communication initiative in terms of campaigns where you address the public and you address the doctors and the different players involved. Did you understand my question? Is if you refer to a recommendation of health education, but I wonder if you are thinking of broader activity where you also do a more complete campaign of communication about the importance of the proper use of antibiotics.
Okay, yes, we think about it. Education program, we have same, and it's very important for every levels of populations and for poor and for rich people. And if we can show them the impact of antibiotic resistance, I think it will be very important for them, and it let us improve situation, because antibiotic resistance really it's global problem in the all the world. So we will use of the all kind of methods for education. Thank you.
Thank you for a very interesting presentation. And now we're moving to the, thank you.
Thank you.